Okay, in this video, we are going to be looking at the vessels of several models, including our thoracic model, which we have here. And let's start with the one that you should be the most familiar with, which is the aorta. The aorta begins here. This would be the ascending aorta. Where it arches here, this would be the aortic arch, and then this would be the descending aorta. The portion of the descending aorta that goes through the thoracic cavity is called the thoracic aorta. The aorta has three branches that come off superiorly. The first branch is the brachiocephalic trunk, otherwise known as the brachiocephalic artery. The second one here would be the left common carotid artery, and the third one would be the left subclavian artery. This first branch, the brachiocephalic trunk, will branch off to create, that comes off of the brachiocephalic trunk, and this is going to be the right common carotid artery. And remember, this is the left common carotid artery. Okay. And there's another branch that comes off of this brachiocephalic trunk that you can't see, that's basically hiding underneath all of this here. But on a diagram, you should know it, and you'll need to know it on the heart model. And that's going to be your right subclavian artery. Okay. Common carotid arteries are going to start here. The other one starts here. And they're going to continue to go up, and around this area, they are going to, they're going to branch off to form an internal and external carotid arteries. Another pathway here, so here we've got the subclavian artery. And that is going to continue to go around in this direction. It's going to go under the clavicle. And let me just identify some of these veins that we have going on as well. This here would be where the superior vena cava is, the superior vena cava, which goes to the heart. And this would be the right and left brachiocephalic veins. Now, once we get a little bit further, the brachiocephalic veins, once they get around here, around the clavicle region, they're going to become subclavian, the subclavian veins. Okay, the subclavian veins further out. Okay. You also have, this would be the internal jugular vein and the external jugular vein. The ones on the other side you can't see. Okay. There's also a pathway that you can't really see that branches off of the subclavian artery here, and that will give you the vertebral artery. And the vertebral artery is going to go up to the brain through the spinal column, and it will meet with the basilar artery at the base of the brain, and then go to the circle of Willis. Okay, let's take a look at these arm veins that we have here. The arm vein that we have in this area, this is the basilic vein. And on the other side, this large vein here is going to be the cephalic vein. This is the aorta again. This whole thing is the descending aorta. However, it has a different name as it crosses the cavities. So in this area, this would be considered the thoracic aorta. And once it passes through the diaphragm, it's going to enter the abdominal cavity. Once it does that, the name of this is now going to become the abdominal aorta. So taking a look at the abdominal area here, these are our kidneys, okay? The liver has been removed. These would be the renal arteries and the renal veins, renal artery, renal vein. This right here is going to be the superior mesentery artery, and this here is the inferior mesenteric artery. As we continue to descend, the abdominal aorta is going to branch. When it branches, it's going to change its name. Now here I'm going to have the right and left common iliac arteries. Okay. The right and left common iliac arteries are then going to branch into the external and internal right and left iliac arteries. Now the external iliac arteries, as it continues to descend into the region of the thigh or the femoral region, it is then going to change its name. At this point, this is going to become the femoral artery. It's a continuation, the femoral artery. Here on this side, we also see just a small amount of the femoral vein. Okay. So here in the front, we've got our femoral artery and our femoral vein. And that's going to run down and then it's going to continue inside there. Now, a vein branches off of this and wraps around and goes medially and continues down the entire length of the leg. Okay. This is the great saphenous vein, the great saphenous vein. Okay. And if we're going to call any of these veins here the anterior tibial veins. And let me show you the popliteal. Popliteal is in the popliteal region, which is at the back of the knee, which would be located deep in here. Here's the inside of the arm. Okay. So the top here, this is going to be the cephalic vein. The cephalic vein, all the way up there. This is the clavicle. So from the clavicle this way, this region just right here would be the subclavian artery in red and the subclavian vein in blue. And I can go ahead and follow this down. The subclavian is going to turn into the axillary vein, which is right here. This is also the area of the axillary artery. And as you continue down, we can follow this down, and then at this point, let me be specific on a couple of things here. So this bottom, there's actually 3 veins here that run together. The one on the bottom is going to be the brachial vein. The one in the middle is going to be the median cubital vein, and the one on top is going to be the basilic vein, and that'll make more sense as we continue down the arm. So as we go down the arm a little bit further, and I turn it, the top one, like I said, is the basilic, and the basilic is going to start to deviate and turn right here, and it's going to travel downwards, and it's going to be this nice kind of noticeable one there. Okay, we'll turn it back around. This is the antecubital region inside of the elbow. And so this here is the medial cubital vein, the medial cubital vein. Now, this on the bottom, like I said before, is the brachial vein. Now, this brachial vein is going to divide. The brachial vein is going to go in 2 directions. This one is on the side of the pinky, so that's going to be your ulnar vein, and this one will be your radial vein. And those both continue down the arm. The ulnar becomes, goes deeper, so it becomes not visible on this model unless you take it apart. Okay, so looking at the arteries of the arm, the arteries of the arm are very much like the veins. Okay, so this is the clavicle, and so this area just right here on the edge then would be your subclavian artery. The subclavian artery, after it passes that point, quickly becomes the axillary. So this becomes the axillary artery, and then from here all the way down, we're going to ignore this branch now. This entire region here, this is all brachial. Okay, this is the brachial artery. Now, the brachial artery, as you continue downward, you can't see it without taking this apart. But if you remember in our vein model, this does the same thing that the veins do. So the brachial artery is going to split off just like the brachial vein did, and it's going to create the ulnar artery and the radial artery. Now, on the practical exam, in order to ask you what those structures are on this particular model, they would have to point at these areas, which are by the wrists, and that's when they're visible again. This one is on the thumb side, so this is going to be your radial artery here, and this one's on the pinky side. That will be your ulnar. Okay, and on the palms, you need to know that these are the palmar arches. Okay, so here you can see the red, and you can see both the vein and the artery. Okay, so this is the external iliac artery and the external iliac vein. Okay, so external iliac artery, external iliac vein, and then once you cross here, this is going to now become the femoral artery and the femoral vein. Okay. This would be the femoral artery and the femoral vein. Here is the internal carotid artery, And this is the internal jugular vein. Internal jugular vein and internal carotid artery. This is the aorta, ascending aorta, aortic arch, descending aorta. More specifically, this is the thoracic aorta, brachiocephalic trunk, left common carotid artery, right common carotid artery, right there. Okay, this becomes the internal carotid artery as it continues up. This last artery off of the arch here is going to be the subclavian. Now the subclavian artery continues and it goes underneath the clavicle. Subclavian. This is the cephalic vein. Okay. And on the other side, the basilic vein. This is the superior vena cava. This is going to branch off into two directions. One of the directions is going to be the right brachiocephalic vein and the left brachiocephalic vein. As you get a little bit further out here, it's going to become the subclavian vein after it starts to split into the internal and external jugular vein. This is all still the descending aorta, but it has more specific names. This is the thoracic aorta, and once it passes into the abdominal cavity, this becomes the abdominal aorta. There's a few features you need to know here. This here is going to be the superior mesenteric artery. This will be your inferior mesenteric artery. These are your kidneys, and the kidneys have the renal arteries going to them, and in blue, the renal veins going to them as well. Okay, so let me quickly go to the mesentery model. The mesentery also has veins. This here would be your superior mesenteric vein and your inferior mesenteric vein. These structures continue on the back. So if I were to just look directly behind here, okay, this one now is going to be the superior mesenteric vein, and this will be a continuation of the inferior mesenteric vein. Okay. All right, so this structure here, this is a continuation of the inferior, well, actually this is still the inferior vena cava. Okay, and let's go back to the artery. So here's the artery, and now it's going to split into the left and right common iliac arteries. Okay? Now the common iliac arteries are going to then split into the internal and external iliac arteries. Internal and external iliac arteries. And those are going to continue to come downward. And once they pass here, now this is the femoral artery. Okay, this is the femoral vein here. So the inferior vena cava is also going to split in the same manner. the inferior vena cava is going to split into the right and left common iliac vein, and then the common iliac vein is going to split into the internal and external iliac veins. And once they go through this area, you can see it coming out the other side here, you can see a lot more of the vein here. This now becomes the femoral vein. Now the femoral vein also, if you remember from the leg model, has a branch coming off of it, and that branch is going to be that great saphenous vein. And this is part of that great saphenous. So this poor guy only has half a brain. Okay. So this guy only has half of a brain, but that's okay. We're going to love him anyways because he's going to teach us some anatomy. So here is, oh, I guess that would help. Okay, so here's half the brain. Okay. So if you only had half a brain, this is what it would look like. Right, now, the part we're interested in here is here, in the base of the brain. So this is your cerebellum, this is the brain stem. So your the vertebral arteries are going to travel up the vertebra, okay? And then they're going to combine to form the basilar artery. So this is now the basilar artery. The basilar artery is going to continue to go up until it reaches about here. And then this, where it kind of goes inward a little bit, this is half of the circle of Willis, otherwise known as the arterial cerebral circle, otherwise known as the circle of Willis. Okay, and right here at the top, this is actually where the internal carotid arteries are going to enter, the internal carotid artery. And of course, there's one on the other side too. Okay.
The liver. This is the inferior vena cava. These are your hepatic veins. The red here is the hepatic artery. There's a little bit more on the other side too. The red is the hepatic artery. And the structure that's kind of purplish, this is the portal vein. The portal vein. Okay, and if I take this and flip it upside down, gently, okay, so here we have the underside. Of course, this is your gallbladder here. In red, again, we see this is the beginning of the hepatic artery, and this is the portal vein. On this model here, in red, these are the vertebral arteries, and if these were colored blue, they would be the vertebral veins.